This is my 26th year as a school counselor in the state of Vermont. And a big piece of my job is doing what's called prevention work and helping students learn really important social emotional learning skills at the universal level. With Closegap, it's a game changer because as students are checking in throughout the week, I know how students are doing. And so I can see in real time who might need some support. That changes the game completely in terms of being able to support students and their mental health. And you could be sitting in a sea of other students and no one needs to know that you're asking for support right now, or that your day has been a little bit stressful, or you're gonna be using some of these coping skills. You're gonna practice in doing your belly breaths. And so for students to be able to, in the moment, regulate, use the tools that Closegap is suggesting that they could use to help them based on how they're feeling is amazing. It changes the way that I can do my job and best support students and families.
Hi, my name is Rachel Miller. I'm the founder and CEO of Closegap. We are facing a youth mental health crisis. Young people are more anxious, depressed, and suicidal than they've ever been, and it's getting worse. But young people are in schools with trusted adults every day. And if we look to the research, we know that the single most essential driver of youth mental health is a strong relationship with a trusted adult. Schools are the missing link, but they lack reliable ways to monitor student needs in real time and at scale. So that's where Closegap comes in. We built a free daily mental health check-in for K-12 students. It's a safe digital space where students check in with how they feel and ask for help if they need it. School staff get real-time alerts and a triaged roster of their students so they know who to follow up with early and often. And it turns out, when we ask young people how they feel, they tell us. Take Marla, a quiet, well-behaved sixth grader with good grades. But what Marla's teachers missed was that she was struggling with suicidal ideation and self-harm and had been since the second grade. Following Marla's check-in, her school counselor intervened, and now I'm happy to report that Marla's doing very well and has all the supports that she needs in place. Thank you. This is the impact from one check-in. We've captured over 5 million. Thank you. We've uncovered cases of suicidality, self-harm, trouble at home, sexual assault, and food insecurity that would otherwise go unnoticed. And we're redirecting the school's attention to where it can make the biggest difference. Our flagship product is completely free for schools and always will be. To keep it free, we have a premium upgrade that aggregates check-in data so schools and districts can spot trends across demographics and unlock federal funding. We've captured over 100K in ARR and will double that next school year. Thank you. We are a team of parents, teachers, and social workers who have lived the problem we're solving. And thanks to our partners, we've proven that this works and it's scalable. We 10x'd our student user base. We now serve over 200,000 students across all 50 states. Thank you. And as you can imagine, we want to keep that momentum going. So we're raising $1 million to reach 1 million more students by the end of next school year. In a lot of ways, what we're doing is very simple. We're checking in. But it's this simple act at scale that can create systems of care that actually hold our young people so they can be young and well. Thank you.